the deal with red blood cell production? So a hormone from the kidneys called erythropoietin is released in response to low oxygen content that's noted by specialized cells in the kidney. Erythropoietin will travel to the red bone marrow and it'll stimulate production of red blood cells. So red bone marrow is where we make all of our blood cells, but this hormone will specifically stimulate red blood cells or erythrocytes. How many red blood cells should we have? Well, males 4.7 to 6.1 million per microliter. It's a lot. Females 4.2 to 5.4 million per microliter. Why the difference? Well, because of androgenic hormones like testosterone, which are higher in males, we have increased red blood cell production. Hemoglobin, this is the molecule that's on the surface of red blood cells that carries oxygen. That's what it looks like. It has these 2 alpha subunits and 2 beta subunits, a little red dot in the middle. That's the heme, that's where the iron is. So we need iron to make this hemoglobin. So we can see the values there. So it's in grams per deciliter. And hematocrit is the percentage of blood that's made of red blood cells. So again, higher males than females. Red blood cells, they're biconcave discs. They lack a nucleus. They live about 90 to 120 days. When they're worn out or damaged, they go to the spleen. So the spleen is part of the lymphatic system. There's specialized capillaries with these openings called sinusoidal capillaries. They take up the red blood cells, break the red blood cells down. So the splenic vein drains some of the blood to the liver. In the liver, we break down hemoglobin into iron and bilirubin. Iron content is high in the liver. We store iron there. And then bilirubin gets released from our gallbladder as bile in our digestive tract. So what are some causes of anemia? So anemia literally means lack of blood. So the most leading cause is iron deficiency, so lack of iron in the diet, like in a vegan diet, increased need due to pregnancy, increased bleeding, maybe a GI bleed or heavy periods. A folate deficiency in the diet, decreased absorption of B12, we call that pernicious anemia. Bone marrow failure, we need the bone marrow to make red blood cells. Sickle cell disease or thalassemias, those are genetic diseases. And chronic kidney disease. If the kidneys are scarred in the later stages of chronic kidney disease, we're not going to make enough erythropoietin, we're not going to make enough red blood cells. So what causes our red blood cells to be too high? We don't talk about that as often, it's not nearly as common. Chronic hypoxia, so chronically low oxygen levels. Well, the kidneys are going to notice low oxygen chronically, they're going to produce more erythropoietin, you're going to get more red blood cells. So we can see that in COPD, specifically, or more commonly chronic bronchitis. Living at a high altitude will increase your red blood cell count. Having sleep apnea, because you're hypoxic overnight. Androgenic hormones like testosterone, so hormone replacement therapy, patients who take testosterone, this can increase red blood cell production and cause erythrocytosis or high levels of red blood cells. Some people it doesn't, some people it does significantly. It's something you have to watch out for. And then polycythemia, that's genetic, where you have high production of all blood cells. So with testosterone therapy and a high red blood cell count, we have to be careful with these numbers. It's controversial. Should you give blood? Should you not give blood? But really the bottom line is, regardless of who you listen to, if your hemoglobin starts getting close to 20 and your hematocrit starts getting close to 60%, that's when you have to think about doing something or reducing your dose of testosterone.